Welcome back to Rural Health News, the segment of Rural Health Today, where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. First, what's most urgent? On December 1st, the American Hospital Association, the Maine Hospital Association, and 4 safety net health systems from across the country filed a lawsuit in the U.S. District Court to challenge the new 340B rebate model pilot program. As a reminder, 340B is the program that allows hospitals to purchase pharmaceuticals at a discounted price, providing access to essential pharmacy services in rural and low-access communities. The new rebate model will require full payment from hospitals up front, turning the discount into an after-payment rebate, causing overwhelming financial and administrative burdens on hospitals who participate in 340B. The lawsuit requests a temporary restraining order on the program's January 1st effective date, claiming the decision to move forward with the program violates administrative law and disregards the majority of concerns about hospitals and their patients. On to the damage report. The Center for Medicare and Medicaid published a final rule dropping home care reimbursement by 1.3%. While this cut is significantly reduced from the 6.4% proposed back in July, it's still enough to prompt many home health agencies to warn off closures. This service line is incredibly Medicare dependent, and that's due to the patient population it serves. Rural communities are especially in need of home health. This loss will hurt the patients who are living in rural areas who rely on sustained home health services. Also under the final rule, healthcare worker vaccination and health equity measures are being eliminated. In rural communities, primary care workforce shortages are damaging the overall health and well-being of residents. A recent report from the Commonwealth found that 43 million Americans live in areas with too few primary care providers. Other barriers to primary care in rural America include limited broadband internet, a lack of public transportation, and funding challenges for the providers running these essential primary care clinics. When a community has little access to preventative care, poorer health outcomes result, increasing the number of emergency room visits and, yes, even hospital admissions. One of the motivating factors behind these shortages is the rural payer population. For most rural areas, it's not unusual to see 75% or greater Medicaid and Medicare patients combined, making the local healthcare services reliant on proper and necessary reimbursement from these payers. Primary care and other preventative care services are especially at risk due to the workforce challenges and the approach of deep Medicaid cuts. If rural hospitals are going to be able to recruit primary care physicians, advanced practice providers, and the medical assistants necessary to provide primary care, we will need a stronger support system. And now for our success story. The Commonwealth's Fund Primary Care Report also highlights a few encouraging efforts to close the widening care gap for rural communities. Kentucky Home Place is leveraging community health workers to help meet patient needs through health education and chronic care management. In Pennsylvania, a new physician shortage area program is designed to selectively admit medical school applicants from rural areas who are committed to working in rural primary care after their graduation. This program, led by Sidney Kimmel Medical College, includes rural rotation, and it's responsible for 21% of all rural physicians in that state. Initiatives like this are inspiring to rural hospitals struggling to recruit primary care providers. Despite the challenges ahead, healthcare teams across the nation are working together to provide adequate access for patients. We hope Rural Health Today will continue to be a platform for sharing stories like these to prompt new ideas for innovation and encouragement for our rural hospitals. Thank you to our sources for this episode: American Hospital Association, Modern Healthcare, the Commonwealth Fund, and Becker's Hospital Review.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.